Star Gyan Pravah podcast, and today we are honored to have the guest of honor, Dr. Nikhil Panse, plastic surgeon, with us. This is an episode number 363, and this is a magnanimous series, podcast series, a very hit podcast series. It has been started by and is a brainchild of our Fogsi president, Dr. Sunita Tandulwadkar, madam. As we all know, madam is President Fogsi and President-elect ISA for next 2 years. And she is running numerous projects, and her main groundbreaking project is on preconception care this year. We have seen her working 24/7. She is a great philanthropist, great endoscopic surgeon, infertilologist. To her credit are many firsts. And we have also seen, along with Madam's work, her Joint Secretary of Fogsi, respected Dr. Ashwini Kale, Madam. We have seen her working so hard this year, almost, I can say even more than 24/7. And she is continuously on the toes, a very supportive lady. She has helped all us chairpersons in various projects and endeavors. And whenever we have difficulty, she is the first person we can reach. It's a great honor, Ashwini Madam, to have you with us today, and I would like to hear from you on this occasion.
Thank you so much, Rashmi Madam, for this kind introduction. I'm sorry I had to join from the road because I'm in Delhi now on the way to Pune. Today, we launched our joint project with UNICEF here for quality of care in antenatal care and preconception. So which we are going to run across 50 sites in India. So we had a physical meeting today here, and unfortunately, Madam is still in the meeting, but she had asked me to join this because she hardly misses any of this podcast. A very warm welcome to you, Nikhil sir. I think probably this will be a podcast which will be near my heart since my father was also a plastic surgeon. And really good to see you the way cosmesis and the cosmetic surgeries are going on. You'll be very happy to know, Nikhil sir, that this year Fogsi has associated with the Smile Train. Oh, yeah. And yes, and we are conducting their programs also where we are creating awareness regarding diagnosis of cleft lip, cleft palate, so that at least the plastic surgeons don't have to operate these babies so that they are not born and this is diagnosed pretty early. Probably I have seen the days when my father used to operate these cases a lot because there was not much of an awareness and diagnosis. But now over a period of 10-15 years, these cases have literally reduced and Smile Train is really working very hard. And another concentration this year for Sunita Madam's project is on Sampurna, which is preconception care. So we are in align with FIGO this year and also working with the Government of India towards preconception care, where we are targeting all these women and the girls towards their nutrition, vaccination, optimization of BMI, obesity, everything. So that is also gaining a lot of momentum. So we are very happy to have you, and I think I'll join in from the viewers link and listen to this on Mommy Makeover. This is also another interesting aspect for us as gynecologists.
And it was one thing from
you all the best.
Yeah. And it was so warm to know from Ashwini Madam that she was so interested in our topics today, and she was so happy that we will be talking on particularly this aspect, Mommy Makeover, and the aesthetics and beyond obstetrics, what we can explore, aesthetic wellness and the makeovers. So thank you, Ashwini Madam, and I would like to introduce Dr. Nikhil sir to the podcast today. Dr. Nikhil is Professor of Plastic Surgery, BJ Government Medical College and Susun Hospital, Pune, and he is a postgraduate teacher of plastic surgery. He is Associate Editor of Indian Journal of Plastic Surgery and Editorial Board Member of Journal of Hand Surgery and Indian Journal of Burns. He is also the Chairman of Tissue Transplant Committee, Western Region, Ministry of Health and Family Welfare, Government of India. To his credits are many awards, grants and fellowships. In detail, we would like to talk about his patent on epidermal suspension spray device. And he has been awarded with the Dr. S. Raja Sabhapati Leadership Award 2023 from the Association of Plastic Surgeons of India. And also, he has received the grant, Nidhi Prayas grant, from Department of Science and Technology for project on hand rehabilitation device. Notably, he has received the Best Teacher Award from the BJ Medical College and also Biotech Exhibition Grant from the Government of India. He is a recipient of Killer Essay Award in 2015 and also in 2013, and Best Paper Awards at 2015 and 2010, and also Ganga Hospital Johnson & Johnson's Fellowship in Hand and Microsurgery in 2010. So to his credit are many publications, books, chapters written, and I will say I would like to go through 3 books of Dr. Nikhil: Cows Don't Give Milk, and other short stories, Prevent Burns, Prevention is Better Than Cure, and Navigating Dialysis. But something I would like to say that I have seen Dr. Nikhil since college, and I will say on record that I am so proud of his accomplishments, and it's a great honor, Nikhil, to have you today on this podcast. And
Thank you, Rashmitai, for the kind words. Rashmita is elder sister of one of my dear friends. She's also my senior from MBBS days, so our journey goes years together. And thank you so much for the kind introduction. And also, it was so nice to meet Ashwini madam over here, because Yedikar sir is one of the towering figures, is one of the pioneers of plastic surgery in India. And I didn't knew ma'am unless we had a brief introduction right now. So it is a pleasure to interact with you. So thank you so much.
so Nikhil, how are you?
Yeah, all good, all good.
Yeah. So the Diwali is approaching, and
Yes.
when first thought which came to my mind when we finalized that we could do this podcast was, for so many years we have seen your public awareness messages during the Diwali days on prevention of burns due to crackers, firecrackers. And because I remember it in this context, I must say that it has really made a long-lasting impression on the minds of the people, those who are watching. So that's a great public awareness job. So how do you think people's mentality in accepting this prevention? Is it changed? Is it better now?
I think it is something which is difficult to assess. Behavioral modifications are very difficult to assess, but what we can do is we can keep on bombarding people with messages like pour water on burns. So since past 10, 15 years or so, myself, my entire department, the entire Association of Burns of India, so every Diwali we try to focus on prevention. We try to focus on messages like pour water on burns. And I think Diwali is just a few days away, and we'll be starting again those awareness initiatives from tomorrow. So yes, I would like to believe that it has made an impact, although we are not able to document it. But yes, even a single burn injury which is prevented is worth it, worth all the efforts, I would say.
So people are more accepting, and
Yes,
I think the mentality is changing.
yes.
Like we can say, yes,
And
like
I
we
would
can say
say the
some,
incidence of the burn injuries has also gone down. Initially, we used to have our wards full with burn patients. Now, over the past few years, the trends are decreasing. Scald burns are going down. Electrical burn injuries are going up. But overall, I would say the burn injuries are getting down. Yeah.
so it's a great work. It's really a great work, and to make this impression on the people's mind and change their acceptance or giving importance to all this is really very great. People are changing. I mean, the patients overall, their mentality is changing. They are more accepting to the changes in treatment, like over last 25 years, and OBGYN. So the journey is like not much is needed to convince the patient that she is going to require this treatment, maybe for an emergency anesthesia or a normal delivery, to a middle phase where we have to emphasize and explain everything, take the risk, and let them take decision what they prefer. To the very young generation, next generation, who come to the OBGYN and demand that yes, they are delivering at your place, but they want to know in details about the makeovers afterwards, the mommy makeovers.
Yes.
So this is a very great, beautiful change we have been observing for last some years, and this term is so frequently heard more frequently heard these days. So could you just start? What is this exactly? What does it mean?
So yes, mommy makeover is a term which has been increasingly used these days because thanks to social media is helping plastic surgery in a way by promoting this term. But as we know, pregnancy induces endocrine and metabolic changes, and obviously motherhood changes the body. So it causes laxity of the tissues. There is breast ptosis. There is elongation of tissues. There are striae. Then there is breast deflation. There is abdominal laxity. There is divarication of recti, and so many things happen in the female body after motherhood. And mommy makeover is a vague term, I would say, which is a individualized or a personalized thing for each and every individual patient, which includes procedures which addresses these anatomical and physiological changes in the patient. Now, these procedures can include abdominoplasties, liposuctions, breast implants, breast reductions, mastopexies, and it also encompasses procedures for vaginal rejuvenation. So essentially, I would say mommy makeover is a package of multiple procedures, and of that package, it has to be individualized depending upon the patient's own requirement, what the patient wants, what the patient feels like. So that is essentially about mommy makeover. And you also said that you, as gynecologists, as obstetricians, you are also seeing an increasing trend whereby patients are coming and asking you about what can be done at a later stage. So that is also a good thing because I think the demographics are changing. Women are earning more, women are spending more on themselves. There is late childbirth, there is re-career entry later on. Then I would say there is some amount of societal acceptance to this as well. And to some extent, there is societal pressures as well at workplace. If somebody is looking good, somebody is looking wearing a particular type of clothes, you also feel like doing it. So some sort of societal pressure is also there. And I think these are a variety of changes which have come up. Women are spending more on themselves as well. So all these things have cumulatively brought this mommy makeover up in a big way.
But there must be some demographic variation on how this trend is catching. Is it catching fast? Is it catching in some urban areas only, or also common in other parts of India? How do you see this?
I think so. Looking at demographics of this trend, it is more in the metros. But I think it is gradually soon coming up in tier 2, tier 3 cities as well. The demographic trend is soon changing, and motherhood affects everyone. Everyone wants to feel better, look better, and now we have means at our disposal. Good hospitals are available even in tier 2, tier 3 cities. Trained surgeons are available. We have a better understanding of anatomy and physiology. So I think currently even if we have more amount of patients in the metros, this trend will soon change and will have increasing demand everywhere.
And you said it's a package of things. But what about the safety profile? How safe are these?
So this is a common question which is asked not just about the mommy makeover procedures, I would say, but all cosmetic surgery procedures as well. So I would say that these procedures are as safe or as risky as any other procedures. So if there are comorbidities in a particular individual, obviously the risk profile goes high if we operate without taking care or without controlling those comorbidities. But if we have good control over the comorbidities, if the patient selection is good, if the infrastructure wherein we are operating is good, they are reasonably safe procedures. And I would say if we don't combine multiple procedures together, we take a look at the patient safety profile and operate, these are safe procedures, as safe as any other procedures would be.
But do you also generally observe that these patients, they are more demanding about the results of their makeovers? Like, are they more inclined towards success of these procedures, the way they want?
Yeah, that is obviously there because as we know, these procedures are not uh, sort of necessary procedures. Like there is a gallstone, patient is having pain, we need to remove the gallstone. But this is something which is enhancing the aesthetics. So we would say that these are not patients, these are clients. They don't have any major problems when they come to us. And so the expectations are very high. It is important that we address these expectations because like all surgeries, it has got its own set of complications. And one of the important things we need to address is the very high expectations of the patients. So I think if patients or mothers who want to undergo these patients have a heart-to-heart discussion with their plastic surgeon and understand the limitations of each procedure, understand the potential unfavorable results of each procedure, then there is nothing to worry about. And I would also like to say that our patients want to look good in clothes. Unlike the Western population, which wants to look good without clothes on the beaches, our mothers want to look good in clothes. So a bit of scar widening here and there. They are more accepting to the small unfavorable outcomes as compared to the Western population, I would say.
Yeah, right. And what the patient they ask generally about the procedure and what we should suggest them, what should be the best time for these makeovers if they
Yeah,
want
so
immediately
yes.
after the childbirth or there should be some gap. How should we advise them?
Yeah. So immediately after childbirth is definitely not the time because at that time breastfeeding is going on. There are a lot of hormonal fluctuations which are going on. The weight is not yet stabilized. So all these things take time, at least 6 to 9 months when the patient has stopped breastfeeding, when the weight is stabilized at least for 3 months or so. After that, we can think of these procedures. After that, there is no time limit. Anytime these procedures can be considered. The only important thing which is important to note is that the family of the patient should be completed because if we are planning an abdominoplasty or so, we are excising some amount of skin, some amount of tissue, and we don't want to do that unless the family is complete. So I think these are a couple of pointers which we should consider when we are thinking about timing of these surgeries.
Okay. And one more query, generally they have that most of the patients now the cesarean section rate it has increased due to various reasons. So is it also feasible after cesarean section or are there any advantages, disadvantages to go for these procedures when the patient has undergone cesarean section?
Yes, I got that. So I think these are the patients who benefit most because we already have a scar. We go through the same scar. We don't give additional scars. And multiple pregnancies or multiple cesarean sections, there is a lot more tissue laxity. There is a lot more divarication of recti. And these patients absolutely benefit the most, I would say, because apart from the aesthetic appeal, they also tend to feel good. The backache is gone, the minor aches here and there, the divarication of recti because of multiple pregnancies is corrected. So absolutely these patients tend to have the maximum amount of benefit, I would say, from these procedures.
There is one very common question. Everybody wants to know how much weight they are going to lose after this procedure. Very
Yes.
common and everybody, literally everybody wants to know this.
Yeah, absolutely. Because when we look in the mirror, we feel that flab of tissue in the lower abdomen, and everyone wants that to go, and everyone wants that should be maintained without coming back. But yes, this is a very commonly asked question and a very common misconception. All the procedures, liposuction, abdominoplasties, are purely body contouring procedures. They are not weight loss procedures. Obviously, some amount of tissue is excised in abdominoplasties, some amount of fat is aspirated in liposuctions, but few kilos here and there, maybe 2 to 4 kilos max, I would say, not more than that. These are mainly contouring surgeries, and if the patient has got expectations that there will be some amount of weight loss after these procedures, and if the intention of doing these surgeries is weight loss, then they are not the ideal candidates for doing these procedures because weight loss is not our aim. Recontouring, redistribution is our aim of these surgeries. So there is no weight loss, I would say.
But what general people will think that the patient, they think that now they have done the procedure, they think that the fat will go. And the next question is, will this fat come again? So I know it's a level question, but would like to know from you.
No, it is a very pertinent question, and not many doctors also tend to know about it. So I'll give you an example. Suppose our body has maybe say 50,000 fat cells or so, and we undertake a liposuction procedure. We remove 25,000 fat cells. Now we have 25,000. So that 25,000 are not again going to go and become 50,000. But the size of those fat globules of those 25,000 fat cells is going to increase, is going to hypertrophy. So that is the reason why we keep on stressing that lifestyle modification, diet, and exercise. So these are to be maintained, without which obviously you will gain weight, you will have hypertrophy, you will sort of not be happy with the outcomes in the long term. So for procedures like liposuction, lifestyle modifications, diet, and exercise are a must.
So when we talk about the makeovers, so can you share any single success story, not in the only in the aesthetic direction, but also health-wise, how we could benefit? Any story if you can share.
So I think you would commonly be seeing patients or middle-aged ladies. They want to wear a particular dress or a particular t-shirt or something like that, but they are not really comfortable wearing those dresses which they used to wear before the pregnancy or before the delivery of the babies, because obviously motherhood changes a lot and there are a lot of hormonal changes, and there is some amount of discomfort in that. But after these procedures, when they go back to their pre-pregnancy state of wearing particular clothes, they tend to, I know this is a very minor thing or minor example which I am giving, but I think it gives them their confidence back, and it reflects in their day-to-day activities, it reflects in their family space, it reflects in their workplace. So these are minor things which affect our day-to-day lives. And for the same thing, even if not, we are talking of mommy makeover thing. Any person, like for example myself, if I keep on looking in the mirror that I am getting bald and I need to go ahead and go in for a hair transplant, and it is constantly bothering me, so it disturbs my entire sort of the cycle of work-life balance. And these procedures act in the same way. It tends to build up your confidence, and it works really well.
So now one question also again comes in my mind. So this is the particular strata of the patient. They are, I think, who demand this. They are very, very busy working women.
Yes.
Career oriented women. So they need to take some time out from their busy schedule for these procedures. How they can adjust these procedures in their working schedule or pattern? How much leave they need to take? How much rest or whatever they will need, and how should we advise them?
Yeah, so that is absolutely very true, because when we plan for any surgery, we need to know what all is going to be the course of action in due course of time. So I would say it is very difficult to pinpoint for all the procedures combined together. But roughly, I would say, depending upon the procedure which the patient has undergone, 7 to 10 days or up to 2 weeks, you get back to your desk job or the normal activities of daily living. You can resume those, and in around 3 to 4 weeks, you can start moderate exercises, going to gym, maybe a bit of tread walk sort of thing. And in 6 to 8 weeks, you are near normal to your pre-surgery status, and moderate to heavy exercises can be considered. So that is the general timeline. So most of the times during vacations and depending upon the time schedule of the individual women's schools of children, so timing can be adjusted, and most of the patients plan their surgeries that way.
And if they are not ready for such invasive procedures, for example, so what we can suggest them, is there something less invasive they can go for?
Yes. So less invasive procedures, obviously, as the term less invasive means, the effects are also going to be less, because When we go in for surgeries, when we excise significant amount of tissues, the results are really good. The results are gratifying for the patient. But yes, there are certain category of patients who are reluctant for going under the knife. They want something less invasive, minimally invasive, quick downtime, good results. So there are energy-based skin tightening devices like radio frequencies, ultrasounds, then things like cryolipolysis, injection lipolysis. Then there can be limited liposuctions under local anesthesia, which can be done. So all these are there, they are available, they are established procedures. But as I said, the outcomes are not as good as the main surgical procedures, and they can be used as an adjunct to these procedures, or depending upon the expectations of the patient, we can offer them to the patient.
Plastic surgeon's life is such vast. It doesn't limit only to aesthetics. So when it comes to gynec, there are so many Mullerian duct anomalies, etc., which can be repaired. New vaginas can be constructed where they are absent. It's a vast thing. And but to plastic surgeon, Dr. Nikhil Panse, when he's talking about aesthetics in the plastic surgery, what do you think? Is beauty skin deep?
Absolutely not, I would say. Beauty is in the eyes of the beholder, as we all know. So I think it is about how we see ourselves in the mirror. If Vin Diesel sees himself in the mirror as bald and bold and beautiful, and if we all see him that way, hair transplants wouldn't have come into picture, I would say. But not everybody feels that way. There are people who are not comfortable with the bodies they have. And now that, as I said, science has advanced, our understanding of the tissues have advanced. We have better instrumentation available in the market. We have better hospital facilities. And when all these procedures are available, then if someone is not comfortable or having some sort of inhibitions with his or her own body type, and it can be corrected, then I think yes, he or she should go for it. So I think the answer to your question is a bit difficult, but it has to be in the patient's own eyes, I would say. If you are comfortable, it's perfectly fine. Don't care what the world says. But if you are not comfortable, we have options which are available for you.
I absolutely agree. So if it's making her more confident, I'm more happy, I think if she's ready to go for this procedure, she should go.
Absolutely.
Absolutely. Absolutely. And she can have the wrinkles of wisdom as she's aging. But also, this wisdom can lead her to the procedures which can correct the wrinkles, and she can use the various methods like the fillers, etc., Botox, etc. So you have so much experience in this area also. Would you like to say something about it?
Yeah, absolutely. Now, Botox and fillers, they can be a part of armamentarium. They are a part of armamentarium of any plastic surgeon, and the indications are like Botox is mainly for our wrinkles, and fillers are mainly for age-related deflation which occurs in the face, the structural support which goes. So we are not aiming at changing the face of the patient. We just want to look fresh. We want to look energized after taking Botox or taking fillers. The glow which is lost. So fillers tend to volumize the face and the glow comes back. And same thing is true for Botox. Now, the thing about Botox is we need to keep on giving it repeatedly at 3 to 4 months interval because the half-life is so. But fillers tend to stay for a longer period of time. And yes, again, these are those procedures which are office procedures. They are subtle. Just while coming to the office or going to the office, you can have a Botox or a fillers, and nobody will know exactly what you have done. But everybody will start feeling that they are कुछ अच्छा दिख रहा है, कुछ अलग दिख रहा है.
It will not be obvious, but some effect will be.
Yeah.
Yes, absolutely. But sometimes the women, they can have dilemma. They are not able to arrive at a conclusion. If really they want to go for procedure or they do not want to go for procedure, they have some inhibition, they have many questions. So how do you help them in deciding what they should go for or how they should go for it?
So I get that, as I said initially, to do or not to do is a very genuine dilemma, especially for mothers in our country, because they think that their whole life they have worked for their children, and even now they feel that, which is obviously true. It's not that they have not done, but I think if they feel about themselves, I would suggest that the initial period has gone. Now we have all the infrastructure available. These procedures are not being done on an experimental basis. They are being done regularly on and off. India is a major hub of medical tourism. We are getting patients, international patients, coming to India and getting these procedures done. So safety, efficacy, established procedures, all these are gone. Now it is just a concern about addressing the needs of that individual patient. So I would suggest go ahead, talk to your plastic surgeon, have a chat about what your requirements are, what you want out of a particular surgery or what you want to get corrected. And if you are not having very high expectations or
Realistic
expectations which can't be fulfilled,
Yeah.
then I think these decisions are fairly easy to make. The thing is taking the first step. I think going out and consulting with a plastic surgeon is the first thing which you need to do where if you are planning for any cosmetic surgeries. You see some before after patients. If you're okay, if you're comfortable, fine, go ahead. Otherwise, it's fine. So I think it has to be done step by step.
The realistic expectations they should have from the
Yes, absolutely.
That adds to the success of the procedures.
Yes.
Yes. So it's so nice to speak with you, and because we have time constraint, otherwise we would have continued this and would also like to have one more episode with you because there are so many questions unanswered still. But I would like to take a message from you, Nikhil, because Diwali is approaching. Your work is high in this area for firecrackers and prevention of burns. That message I would like from you for the audience of this podcast, and also a message to the gynecologist about all this we talked makeovers and aesthetics and how they can confidently adapt and accept their bodies.
Yeah. That Diwali is soon approaching. I would say enjoy your Diwali, burst your firecrackers, but do it safely. Be vigilant about it. And if at all there is a burn injury, pour water on burns because that is something which is not done. It is commonly considered that pouring water on burns causes blisters, but it is not so. You should pour water on burns for 15-20 minutes continuously till the burning sensation stops. And that is the best first aid which we can have for any burn injury. Keep a bucket of water ready during Diwali times, diyas and all pantis. When you are lighting them, see to it that our festive clothes, ghagra and all those things, they are likely to get burnt because of those diyas. So keep it in a bit of side and be vigilant. That's all. And for message to my gynec colleagues, I would say that you're the first responders for the patient. Not even most doctors are even not aware of various procedures which are available to address the issues, not just about, I would say, abdominoplasties, liposuctions, and breast surgeries. There are also a variety of vaginal rejuvenation procedures which are functional, which are aesthetic in nature. So these procedures, I would say, since you are the first responders, if the patient confides in you, I think we should let the people know that these procedures are available, and that is all about it. If patients are comfortable, there's obviously no need because these are aesthetic procedures. But if there are certain problems which we can address effectively, I think we should go ahead and create an awareness in the patient that all these procedures are available and we can address these issues. So I would say that's all I would like to say, and wish you all a very happy Diwali.
Wish you a very, very happy Diwali. And to the all viewers of this podcast, we wish a very happy Diwali. So Nikhil, it was such a great honor to talk with you in details about this something new in our field. And as you correctly, very rightly said, we are the first people, the women would come to us. We are as good as family physicians to generally to the women. So not only the gynec problems, but rest of the problem also they come to the gynecologist for them.
Yes.
So it's a duty on our part also to propagate this knowledge, what is available, what we can do more for their betterment, and we can suggest them. So that was great information, and would like to talk more with you again sometime in future. It was
Absolutely.
nice.
Pleasure was all mine. Thank you.
Thank you so much.
Thank you.
Thank you very much.